Today we're placing some PDO twisted threads in a submental area. To begin, I am just making sure the patient is clean. I went in with a chlorhexidine prep first, and now I'm just using an alcohol swab to make sure that everything is nice and clean prior to starting our treatment. The patient was also numbed topically prior to this, and now I am just going in and just estimating where I want to place my threads. I chose to use 20 PDO twisted threads for this patient, just to make sure that I'm covering that entire treatment area. There really is no wrong marking as far as placing our threads. We just want to ensure that entire area is covered. You get about 1 millimeter to 2 millimeters of collagen stimulation surrounding each thread. So we want to pack these pretty close together to get the optimal results. This is this patient's first treatment, so his first of 3. For best results, we like to see our patients every 4 weeks, about 3 times. So obviously this can be repeated, but we tend to see the best results after at least 3 treatments. So now we're just going in and beginning. I'm making sure my bevel is up, finding my plane, and then giving the thread a little bit of a push. The twisteds tend to need a little bit more of a push than the smooth, just because you kind of get that twisted thread just gets a little bit caught in the tissue. But this is a relatively comfortable procedure. Like I said in the beginning, the patient was numbed topically prior to this, but as you can see, he is pretty comfortable here. And this is his first time as well, like I said. So I am just going straight across. I like to stand above my patient just so I can have like a straight plane downwards, and then I will move to each side. For the threads, you want to make sure that the entire thread is covered prior to removing. So just make sure that your little pledget or that white marshmallow has moved off of that thread so it completely engages in the tissue. So here we go. We are doing this side first. Like I said, you just need to give a little bit of a push here with the twisteds. And my lines are just an estimate of where I want to be. You never want to be placing your needle directly through your marking. So I'm just going right in between those and making sure I'm getting them as close together as possible. If it is easier, you can go ahead and remove your threads as you go. I like to keep mine in just so I can see where I want to place them and have them as close together as possible. But if you want to twist and remove as you go, you can do that as well. And now just moving on to our last side here. I have 5 more. Like I said, I did a total of 20 for this patient. So I'm just going in with my last 5. And then we're going to give our threads a 360 twist to make sure that thread is engaged and pull them out. And then I will get this patient scheduled for his next treatment. Like I said, it will be in 4 weeks from his initial, and then 1 more after that. And we will kind of assess at that point what results he received and if he wants to continue on with maybe another round or maybe switch to another modality at that point and then come back to threads. It really just depends. So I'm just placing my last thread here, and then we're going to go ahead and remove. There's that 360 twist. I'm just making sure that all of my threads are completely covered, and remove. If you ever pull out a thread and some of it is hanging out of your insertion site, take some clean tweezers and just go ahead and grab the end of that and pull it out. You don't want the patient leaving the office with anything, hanging out of the insertion sites, because of course they might go home and touch the area, and that is a high risk of infection. So if any of your thread is hanging out, just grab the end of it with some tweezers, clean the area, and place another thread. Here I'm just taking out the last 5, giving them a nice 360 twist and removing.